right, so I want to get started actually pretty much right away because I thought since yesterday we did more of like a clinical format for looking at the upper body, that today I would offer you more of a gentle class where I would incorporate things that help with the lower body and more. Again, I'm obligated to use air quotes because I'm not a certified therapist. So these are therapeutic actions. And some of them, in fact, are physical therapy exercises that I have learned from physical therapists. So, so we'll do a lower body oriented, gentle yoga practice.
We have time to take notes if we need to.
Please do. You read my mind. Yeah. So even though, and we'll be going slow enough that you'll have time if you want to make notes. And please do ask questions too. And it can be more informal. It doesn't have to flow like, one person's talking and everyone else is receiving. But I thought I would offer more of a kind of a steady clip today. Okay, so we're going to do a bunch on the floor in the reclining position first. So if you need to build your nest, have your notebook nearby and make sure that you have 3 straps, 2 blocks, a blanket, and a bolster. 3 straps, 2 blocks, a blanket, and a bolster. And please lie down. Bend your knees. Place your feet on the floor. It's nice to see your face. So as you lie down and place your feet on the floor, soften your gaze or close your eyes as you feel comfortable doing so. And try bringing your hands onto your breathing body, maybe one on the chest and one on the belly, or you can place both on the belly. And begin to tune in to the natural rhythm of your breath. Just as it is. Notice the movement of your breath. The rise and fall of the ribs and lungs. With exhalation, let the head become a little heavier, relaxing the muscles of your neck. Try swallowing once to soften your tongue to the bottom of your mouth and part your teeth slightly. If you haven't yet, do begin to slow and lengthen your breath. Take a longer inhale through your nose and exhale through nose or mouth. Again, slow and full inhalation. Exhaling through your nose or your mouth. Continue this way, observing a lengthier breath and the way that it moves the body in a 360-degree experience. Notice movement in the sides of your torso and in your back body. You might observe an expansive quality on inhalation, almost as though the body lifts away from the floor, and your exhalation, a condensing or settling quality as the back body becomes heavier on the floor and the front of the body settles back into the back.
Now, let your awareness expand outward to your limbs and include your neck and head. And observe any resting tension in these areas of the body. And with your next few exhalations, invite a softening into your limbs, neck, and head. One after the other, bring your knees in towards your body and hold onto your knees with your hands, pointing your fingers toward your toes. So you're cupping the tops of your knees with your hands. One hand for each knee. So turn your hands so your fingers are facing your toes. There you go. So Apanasana, this is a downward flow of energy. So on an inhale, take your knees away from your body until your arms lengthen fully. A little bit of grip there with your knees. And then exhaling, draw your knees in toward your chest or shoulders. So elbows bend as you draw your knees in toward your chest or shoulders. On an inhale, knees draw away from the body, lengthening the arms. Exhaling, knees in toward your chest or shoulders. So Apanasana, dynamic movement. Let's do 5 more. So breathing in, the knees move away. And breathing out, they draw in. Keep a grip on your knees with your hands, fingers. 4 more as you breathe. Inhalation, the knees move away. And exhaling, they draw in. Good. The last time your knees come in towards your body, if you'd like, you can hold them there. They can be more together or more separate. And give yourself a hug. If you'd like, you could roll some from side to side or even move the legs independently, just creating a little bit of circular movement for your thigh bones in your hip sockets. Maybe some massage for the back body, the back of the pelvic bowl, rolling some from side to side on the floor. Long, slow breath. Now let this be intuitive, as our dear Bonnie Samoa says, let a sense of pleasure be your guide. When you're ready to stop, lower your feet down, and if your head is near the wall, scoot forward on your mat so you have enough space behind you to reach your arms all the way up and overhead. And that's a feat in and of itself, right? Figuring out how to scoot. All right, so knees bend. Test your space behind you, arms up and overhead toward the floor above you. And then arms down. And one after the other, gather your knees again in towards your body. So both knees coming in. And then keep your knees in towards your chest or shoulders and lower your arms down by your sides. Let's revisit Urdhva Prasarita Padasana. So we did this one, I think, quite a bit toward the beginning of our training. We'll revisit it now. So just the legs moving first. As you breathe in, reach your heels up toward the ceiling, stretching your legs long, flex your feet. Exhaling, draw your knees back in towards your body. Yep, just using the legs. Inhale, stretch your legs up. They do not have to straighten. Exhale, draw your legs back in. Let's add the arms now. So as you breathe in and legs lift, reach your arms up and all the way overhead toward the floor above you. So heels toward the ceiling, fingers toward the wall behind you. Exhale, knees in, arms down simultaneously. 4 more. Inhale, legs up, arms overhead. Exhale, knees in, arms down. 3 more as you go. Good. The next time your legs reach up and your arms reach overhead, pause, take a breath in your outstretched position. And then keeping your legs up on your exhalation, lower your arms back down by your sides. Separate your feet some more and circle your feet on your ankles. 5 times in one direction and 5 times in the other. And now can you take both of your feet and circle them counterclockwise? So move toward the right, toward the left. And then clockwise, move both feet toward the right. So, and then draw your knees in towards your body and lower your feet back down onto the mat. Pause and just observe any blood flow, sense, tension moving to different parts of the body. Yes, so it's good, especially in gentle yoga, just to trust any natural movement that arises. You might find that you're rocking a little bit from side to side, or you might find yourself in stillness with awareness on your breath. Let's do some abdominal bracing, just a little bit more abdomen on line. So one after the other, draw your knees in towards your body. So both knees coming in. This time, instead of gripping your knees with your hands, gently press the heels of your hands into the tops of your knees. And so try to bring your thighs so they're perpendicular to the floor and your shins are parallel to the floor, like you're sitting in a chair. Yep. And then press your hands into your knees. And hold here as you breathe. So hands on the tops of your knees towards your thighs. Thighs perpendicular to the floor. So thighs straight up. Yeah, there you go. You know, this is easier to do than it is to say. So one more full cycle of breath here. And then one after the other, lower your feet back down. And consciously relax your belly muscles. Notice the shesha, just the residue of sensation from a gentle or perhaps strong engagement of your abdomen. Good. So knees bent, feet on the floor in preparation for a small bridge pose. So feet about 6 inches from each other and about 6 inches from, heels about 6 inches from the bottom of your bottom. If you're experiencing any discomfort in your sacrum or your lower back, you might like extra support here with a block between your knees. So if you want, you can grab a block and place it, I would say, at the narrowmost setting or the middle size setting in between your knees. You can also simulate what the block does, because we're creating isometric engagement, right? The legs are squeezing toward each other without moving. So you can imagine a block between your knees and isometrically hug your legs toward each other. Good. All right, so bend your elbows 90 degrees. Hips are still on the floor. You can place your hips down. And keeping your hips on the mat, press into your upper arm bones until you feel your mid-back arch away from the mat. So you're creating a little bit back bend. You might even be able to tuck your shoulder blades in and under you. Take a breath or two here. And then 1/3 of the way, press into your feet and lift your hips up toward bridge pose. 1/3 of the way. Pressing into your feet, lift your hips up toward a bridge. So not much. Breathe 3 rounds here and try to press down a little bit more through your upper arm bones from your shoulders to your elbows, press down. And use the power of your arms to pull your chest in the direction of your chin. So try and lift your heart towards your chin and just a little bit pivot your chin away from your chest. Excellent. Big breath in. On an exhale, lower back down. Arms can relax. If you have a block between your knees, you can remove it. And pause, maybe hands return to the breathing body, either both to belly or one to belly and heart. So gentle doesn't necessarily mean easy in two different ways. We might actually practice very strong poses, stabilizing poses, but there's also an element of challenge in gentle yoga to become more observant of subtle sensation in the body. And start to tune into how prana moves, vital life force. And prana can be something as simple as paying attention to the sensation of blood flow change. If a certain part of the body was elevated above the heart and then it comes back down, can you tune into just the whooshing sensation of blood or nerve flow returning to a part of the body? Check in again with your periphery, arms, legs, neck, and head. And with the next couple rounds of exhale, what can you soften? If you're one like this body who carries tension in the jaw, you might take an extra moment here to swallow, relax the tongue, and part the back teeth slightly. Good. All right. So far, just to break the fourth wall, we've done only symmetrical shapes. So we'll start to move toward asymmetry now. Let's draw the right knee in toward the body. Draw your right knee in towards your body, and you can hold on to what you can reach easily. It could be your pant leg or your knee or the back of your thigh. And just notice any sensory shift, even just doing that. And since we're moving gently, yes, please do trust yourself. Like these postures are so ingrained. We do Apanasana so often. Notice if you just went into it immediately, and that's great. That's wonderful. And if your left foot is still in the same spot, try incrementally sliding your left foot forward. So move slow, maybe even pausing in a certain position to take a breath. Notice what musculature is engaged and how the two pelvic halves are relating to each other in different phases of the journey toward lengthening a left leg. And then once you've arrived in the shape for you, try strengthening your left leg like you're standing on it. So flex your left foot, keep breathing, yeah, good. And try to keep your left toes facing the ceiling, maybe even slightly toward the right, like you're spinning your whole left inner thigh in and down, tacking your left inner thigh in and down. Keep breathing. And then as your left leg engages as though you're standing on it, keep that and bring awareness to your upper body. Can you do less in your shoulders and in your neck? Maybe just use your fingertip grip. Can you broaden across your chest a little bit more? Take your shoulders back. And then find the pranic line from your heel all the way through your spine to the crown of your head and lengthen along that pranic line. Beautiful. When you're ready to come out, bend both knees, returning both feet to the floor, and pause. Bring your left knee in toward your body. So left knee drawing in, attentive to even the subtle shift of drawing the left knee in and how the two pelvic halves change in their relationship to each other. So there is now a subtle twist in the two pelvic halves. As you feel ready, slowly slide your right heel forward, lengthening your right leg. In the mind's eye, note any difference between sides. So you think back to having your opposite legs. Is this side more fluid than the other, or is this side more gummy than the other? Imagine you're standing on your right leg. What would you change? Try to tack your inner right thigh down, and imagine your leg begins behind your navel, and from your navel point, lengthen down the inseam of your right leg to your heel. Yeah, good, because your leg actually does begin behind your navel. That's where the psoas starts, and it inserts on the inner upper thigh bone. Can you do less with your shoulders, with your neck? Broaden and soften your shoulders back and down. And then last couple of rounds of breath, try to seek out the pranic line from your heel all the way through your leg, your spine, and to the crown of your head, and lengthen. Nice. Right. When you're ready, bend both knees, both feet return to the floor. Pause. Let's add just some gentle functional / somatic movement here. So arms can open in a T or in a cactus shape. And keeping your knees bent, separate your feet a little more, maybe even mat distance apart. And take your knees right and left. And you might start small, just right and left. And notice, actually let this be a study in the moment where the movement goes from the hip joint only to having an influence on the movement of the pelvis and the lower back. Does that make sense? You might start really small, and there's not much pelvic movement, only the awareness of the femur bone moving in the hip socket. And then as you start to add larger movement, where's the moment that the pelvis becomes a part of the movement process? And how does that affect the sensation in your lower back? Take your time. So just to give you an idea, we're going to spend about 3 or 4 minutes doing this. It could become a gentle twist. Trust yourself to pause anywhere along the way and keep breathing. You might even notice when you come to an interesting moment inside the movement that the breath can really rush in. It might actually elicit a deeper, fuller breath when you find a moment of tension or boundary. And notice if as you're concentrating, your brow is furrowing. Can you take the energy of your concentration and send it downward into your hips, relaxing your face? So trust yourself. I am encouraging you to keep your movement pretty simple and small, but if something more calls to you, like crossing a foot over a knee or bringing in the legs to stack more for a greater spinal twist, that is all also fair game. Yeah, this is really lovely. It's almost like a water ballet. Good. So take another breath or two here to resolve the two sides. And then come back to the middle and pause. And try to cultivate a sense of evenness in the left and right pelvic halves. If they don't feel symmetrical, that's of course fine. No two sides of the same body are the same. But you might imagine a feeling of symmetry. So when you're ready, bring your knees in towards your body. And if you would roll over onto your side and slowly come up to sit, I would like for you to see a demonstration of this next one. Normally I'd have you just stay on the back so we don't shift the energy too much, but I do want you to see this because this is a PT exercise and it's very specific. We may have gone over this when we did SI joint stabilizing toward the beginning of our training. So the first thing I'd like for us to do is practice the Lumbo pelvic rhythm exercise, or a Lumbo pelvic rhythm exercise. And is to bring attention to the relationship between the lumbar curve and the position of the pelvis. So we already did this somewhat when we came to our bridge shape. So I'd like you to, on an in-breath, tilt the pelvis forward. And I'm exaggerating this a little bit. You might not actually move this far and have this big of an arch. But so when the pelvis tilts forward, we get a lumbar, accentuated lumbar curve. That's on inhale. And then on an exhale, you tilt the pelvis back down, almost like you're going to pick up the tail, but I don't actually want you to scoop under, just to return back until the spine is on the ground. So we'll do that a few times. This is an inhale to lift the belly and roll the tail forward. And an exhale to take the belly down with the sides of the waist back and nestle the pelvis. So it's posterior tilt. Inhale forward, exhale back. So take your time with that one first. And while you're up, I want to show you the next one. So for this next one, we're going to do some asymmetrical movement to stabilize the sacrum. So for this one, try and find anatomical neutral on the floor for the sacrum. And remember, the sacrum sits at a 30-degree angle. So if we're finding anatomical neutral, the pelvis is actually slightly forward tilted, and there's probably going to be a little bit of space underneath your lower back. You know you're doing gentle yoga right when it becomes difficult to form thoughts into words. Okay, so then knees at about a 90-degree angle. And without moving the position of the pelvis, start to engage as though you're getting ready to lift the right foot away from the floor. So in my body, I don't know if you can see any of this like externally, but even as, and feel free to come closer if you want. So even without moving, even without lifting my leg, already things are shifting muscularly. And then the leg lifts.
And you only lift it as high as the two thighs side by side. And then it's an inhale to lower the leg. You can put your hands on your pelvis. Inhale to lower the leg without rolling in the pelvis at all. You see the difference? Okay. And then exhale to lift. Inhale to lower. Exhale to lift. Inhale to lower. Y'all need to be my yoga teachers here. Tell me if you see any movement in my pelvic calves. So it's only the femur moving in the hip socket here. And then, and you just do as many as like 5 to 15 until you feel what we might call the good burn. And at least in this body, it tells me that one side will feel pretty different from the other. One side will be easier to do than the other. Okay, so first we're going to do lumbo pelvic rhythm 5 or so times. And then we're going to do essentially the opposite of that, where we're only moving the thigh and the hip. Okay, come on down. Thanks for watching.
Was I in the video? Could you see my hips?
Yes, only was your leg straight when you were lifting it?
It was, yeah. I can do it back a little bit too, so you can see. So. Like that. And there's no movement, yeah, in the hips. So take your time, long, slow breathing. If you're comfortable practicing with eyes closed, that might be helpful. So you're tuning in your sense of sight to your insight. Take your time. When you're ready, you can move on to the SI stabilizing exercise. Remember to start with an arc in your back.
Try to stay tuned in to any subtle difference between left and right. You might find you can actually sense which psoas holds more tightness. It'll be more of a tone kind of along the inner leg as it lifts. And stay with your breath. And when you're done, you can pause with both feet down or do what calls to you. You might feel called to bring your legs in towards your body or to stretch your both legs out long. And let that go. So optimally, the foot doesn't actually make contact with the floor. Yeah. And it's okay for the lifted leg knee to bend. Good. Just keep taking your time, no rush. And if you are done, take a moment just to observe the flow of your thoughts, the quality of your thoughts, and the sensation of presence. Good. Okay, so we're going to work with Supta Padangusthasana series, which is reclining foot to hand pose. And for this, we'll use a strap. So take a moment to find your strap. And start with the right leg.
You want the crazy long one first?
No, just the regular one. Good question. So I'm going to be picky about the placement of the strap as well. So my recommendation is that you use a strap that is not looped and place the strap around the ball of your left or of your right foot. So from the base of your big toe to the base of your pinky toe. And hopefully this also means that you have enough slack on your strap that your elbows can actually stay on the floor. You can also wrap your strap around your hands if you want. And then lengthen your heel skyward. And you might find that you can sense plenty here, so plenty of sensation just inside of this shape. If you want, you can also slide your left leg forward and down, lengthening your left leg on the floor. So let's start first with just some gentle movement side to side, really only in about a 6-inch range. So tick-tock your right leg to the right and left some. Noticing any shift in tone or tension in the different vectors and muscles leading into your hip. Yes, good, breathe. That's really good. You can do more if you want than 6 inches, but for gentle yoga, I encourage a smaller range at first, just so you can really tune into all of the nuance. Relax your face. And then settle into the middle. And we'll try a couple different things here in the middle.
Are we moving the leg or using the hands to move the leg?
Oh, that's a good question. You can do either. Yeah. I was thinking about moving the leg, so,
Okay.
yeah. So, we'll try a couple things here. One would be to bend your knee if you need to, in order to lift your leg up as high as your thigh and hip will let you. So with the knee bent, you might find a sustainable end range as you draw the leg toward your face. Knee can bend. So this, I'm going to talk a little bit about this therapeutically. So the safest way to stretch your hamstrings is on your back. So if someone comes in and says, I tore a hamstring, and they're in the first 6 weeks out from that acute injury, they should not be in your class. So that's another thing. With hamstring injuries, you have to let them rest. I'm sorry, no, 2 weeks. I said 6, but I meant 2. So at least 2 weeks with no movement, no stretching. And then start stretching. And so weeks 3 through 6, safest way to stretch the hamstrings is on the back and like this. So you practice keeping the knee bent and finding a sustainable end range where the source of the injury is silent. So there's no feeling sense of the localized sensation. Breathe here. And then the other thing is to try taking your leg away from your body until you can lengthen the leg fully and easily. And this could be, only a foot away from the floor, that's fine. And then keeping your leg long and using your arms to move your leg. Begin to draw your leg up toward the ceiling, keeping your leg long. And notice if you sense and feel the sensation in a different part of your leg, yes?
Yes.
Yeah. Anyone feel it? You feel it in the gastrocs?
Mhm.
Anyone feel it more behind the knee? Okay. So that in general, when we're in standing forward bending, standing hamstring stretching, we want to avoid the sensation of stretch behind the knee. But here, since we're not bearing weight, we can actually explore the different parts of the hamstring, including the more tendinous tissue and not necessarily the belly of muscle. Now, if you really strengthen and turn on your leg, even if you have to take your leg away from your body more, strengthen, turn on your leg, try and tone your quadriceps. And when the quadriceps turn on, the hamstrings can turn off a little bit, and you might find that you can pull your leg back a little bit more. Good. Anyone else's foot starting to feel funny? All right, let's release the leg and just let the blood flow come back into the foot. You can bend your knees or stretch your legs long, your choice. Interesting?
Yeah, it really like helped. It really good way to go. It was interesting to use. It was like, it seemed really different. I think, wow,
That's pretty cool, right?
yeah.
Yeah.
no,
Much
it's
longer
like-
on the one side.
Yeah, do you have like giraffe leg and a
Yeah.
dachshund leg? Yeah.
Good. And you might also notice, so if I were staying in like total gentle mode, it would stay silent so that also folks can experience that. This is, I think, where we can really help people understand prana, because there's such a big difference in sensation between the two legs for most folks, yes?
Yeah.
And then we start to name it, like the right leg might feel like a different temperature than the left. Or you maybe have more of a sense and feel of the whole leg, like tingling, or like a brightness in one leg.
More alive.
More alive, lighter even, yeah. Okay, let's try the other side. So start with both knees bent, feet on the floor, and then place the ball of the foot in the strap and begin to lengthen your leg up. Now, the only time, so a couple things about putting your foot, putting the ball of the strap around your, putting the strap around the ball of your foot is that it gives us more of an ability to dorsiflex the foot, which can change the stretch sensation in the back of the leg. So it can actually intensify, especially in the calf and the Achilles tendon. So it gives us a little bit more feedback. If you have a student who's healing from an Achilles tendon injury, then the strap goes around the top of the heel instead of the ball of the foot. So there's not that added stretching for the lower leg. When you're ready, right leg can extend. And then start with just a small rocking, or medium or large rocking, up to you, of the left leg to the right and to the left. Breathe. At this point, we've been on the floor for 45 minutes. Note compassionately to yourself any difference in the two sides of the body. Adrian, I just looked over toward the computer and thought you were a mirror. It was trippy. Okay, when you're ready, leg stops in the middle. And then explore knee bent with full range of the leg drawing towards your face. Option to knee bend. I would say even if you know you could like lay your shin on your face, start with the bent knee. And that pose, by the way, like a reclining split like that, is called Trivikramasana.
Reclining shin to face pose.
Yeah, right. Trivikram. It translates to three segmented asana. Think about why that's the name of it. Maybe it's like your spine is on the floor and so are both of your legs. And then if you haven't yet, you can move to the long leg by taking your leg away from your torso until you can lengthen it fully. And with the bones in their extended structure, right? We can even kind of turn the muscles off and use the arms to start drawing the leg forward again. Oh my. Anyone else maybe describe the sensation in the leg as like burning? Does it feel like a smolder, like it's a smoldering sensation?
It's always like that.
Yeah, it's always like that for you?
It's like it's in the stretch thing.
Mhm. And then try coming out a little bit more and now fully engage, like turn your whole leg on, tone your quadriceps and draw your leg more towards your face. And then when you're ready, slowly release your legs. If you feel up for it, you can extend and release both legs on the floor. And then in a Shavasana-like shape, you might be able to tune into the Shesha, right, the sensory difference in the two legs. Remainder sensation. So these postures, I think that Supta Padangusthasana is a master posture in the sense that we get all kinds of ways of healing hamstrings. We get a chance to explore range of motion for the backs of the legs. And we also get stretching articulation for the feet. And we also have our feet up in the air, so we get the added benefit of the legs up the wall, right? Viparita Karani. Say it with me, Viparita Karani. Active reversal, right? So blood pressure benefits, we get to lower blood pressure. It helps with parasympathetic nervous response. It's a great posture to include if you're teaching like an overcome anxiety type class or a yoga for stress management class. Spend time with the legs in the sky. Sometimes, like Mandy said, though, you would do a little bit more movement first, right? To stir things up and then up to the down. All right, let's do one more. We're actually going to spend more. I love this pose so much. We're going to spend a lot of time in it. So let's do now the right leg again. And, oh, no, wait, I lied. Bring your legs in and turn to roll up to sit. And I want to show you this setup with the crazy strap. So, and there are a few different ways to do this. And this is a way to get, like this is in the range of what's called proprioceptive neuromuscular facilitation, which is really fun to say. Yeah, or PNF, which is essentially a fancy way of creating resistance. It's resistance training. So it's creating resistance in the body to then increase range of motion. So like one example of PNF that you might be familiar with is like pushing on the knees in Baddha Konasana so that you can then take them further down. So that's a form of PNF, or pushing on the inner thighs. No, I'm doing this on that. PNF would also be like pushing on the inner thighs or the inner legs to then find more stretch.
I'm TNFing right now.
You are.
There you go.
Your elbows. Paul's pushing on his knees with his elbows. So this one, we get a little bit of that type of structure, but then we also get like a self-assist to help stretch the lifted leg more. So it looks like this. So this leg is going to have a strap on it because it's going to actually hold this thigh in place. And if you see how I set it up here, this way, I have both, I have both buckles not on my leg. Hopefully I can keep it that way. And I want this to be snug enough so that when I press into my standing leg, it's actually pulling the opposite thigh crease that way. This is very Iyengar.
I've seen it too, but you put it behind your back.
You can.
Do the small of your
Yeah,
back.
you can also do it here,
Oh, my God.
which I love.
Oh, I bet that feels good.
Yeah, because then you can use your leg to like massage
Your neck.
neck.
Right.
Okay,
Try that.
so then be picky, be the princess and the pea. Okay. Then the other strap goes around the ball of the foot. Sometimes it can be helpful to have, have a second pair, I might. And you really do want it like as close to your pelvic crease as possible. Oh. Okay, like that. So you can try it this way. If you don't have access to all the strappings, you can also recreate it at the wall. It's a little bit different, but only marginally. So you would actually press your leg into the wall and then use your hand to take the thigh away from the waist and then have your strap. So you're just encouraging more space in the right waist. And yet a third option, are you willing to be my partner for a moment? Sure. So if you come to lie down and let's rig you up in a double strap. Okay, cool. You can have somebody also press down into the top foot. Which you can also explore here with each other if you are willing. Okay, which leg do you want to do? You want to lift that leg up? Okay. So then the strap's going to go around this foot. Yep, you can go ahead and put it on the floor. Here. Does that feel taut enough?
Yep.
Okay, so just as a basis for comparison, you can try it with the strap here. And Judith would be even pickier and say it actually kind of goes like on an angle, so that you're really hitting the base of the big toe and the base of the pinky toe. Okay, and then the other one, is it okay if I stand over your head? Yeah. Okay. The other one, wait, we'll make sure that you can see this. With a partner is to plug the femur into the hip socket. So I like to do this. So on a scale of 1 to 10, I think I'm pushing you about a 2. What do you think?
2, 3.
Okay. So I want to start at 0. And also, if you're gonna offer your own weight, I'd actually also, you can have someone come out of their full range. And then I might offer more.
Yeah,
Okay,
start to feel it behind the knee.
behind the knee, okay,
Yeah.
a little bit in your knee. And then you can also try if you take your foot to the left some. And then just a modicum of weight.
Oh, yeah. Oh, ow.
Ugh.
Oh, no, it's good. It's
Yeah,
good.
okay.
It's a good ow.
Okay. Of course, listening in, make sure that your partner is breathing and not saying ow. Okay, and like I'm pressed, I'm like a lot of.
Yeah, very light press.
Okay, so we'll explore in an uplifted position and then also in the slightly
Against-
crossed position.
Yeah.
You're welcome. Pardon me, I'm gonna step into the restroom. So give it a try. I'll come back out if you have any questions.
I feel pretty good about it.
Really? Every time I
Really?
use this down,
I
I'm
think
like,
it's like, 'cause I'm so tall too, like when I'm holding one with my hand, my elbows are never on the ground, so it's like, you know, so it's just like uncomfortable, I'm like up here. Kind of like-
maybe that's when you use it on the show.
I know, yeah.
Oh,
I should get some shots. I don't know, use straps.
This does make me want to get too.
I know, I'm like, should I get
It'd be cool to have something like handles.
Yeah. It makes some.
No, Kelly, I think it's special handles.
I already know, so-
Maybe if you find that strap, you can like form them.
I'll make my own. I'll do my own with the strap and handles.
There's some cool ones.
What?
They have to have a full name.
Strandles.
Strandle.
That is like so literal.
Oh, my goodness.
Over Paul, you won't have to buy one.
I'm not gonna buy one.
I have the same hammer as it's not a tumor.
This sounds so cool.
How's it? I think it's okay. Yeah, I think I just got some. Yeah, so there's like a little bit of a tug. Drawing your right thigh, the top of your right thigh away from your waist. This is
Instead of tie.
PT for.
Oh my God.
And you're not supposed to feel so, I mean, it's that, like, I'm saying that from what I heard. Right, that we're doing a lot of like deep.
Yeah.
Deep. Yeah. So with someone who has had a hip replacement, this would be really good stuff to work with, but knees bent and just real slow.
And is this building offset energy like that?
Yeah, it's creating, it's lengthening. So folks who have hip replacements will often also experience, you know, the amount of gripping that was required of their body in order to walk on a hip that didn't feel good. There's gripping in the quadratus lumborum and often in like transverse abdominis and some of the flesh and tissue in the front of the hip. And so this helps to lengthen all of that, while simultaneously stretching the muscles that
Is that,
feed into the.
are you referring to adhesions or?
Sure,
Sort, okay,
yeah.
okay.
So adhesions would be, at least from what I understand, again, not a PT. Like adhesions would be, I think of as being like closer to the source of the
Yeah.
discomfort,
Yeah.
and then like it would just be muscle tightness.
I see.
Like gripping or splinting around around the joint that is, not functional.
So, I'm not. So someone with hip replacement needs to move their knees outside of the hip.
Inside.
Inside. So that's like.
So that means, so for hip replacements, especially if they're brand new, and the incision is on the outside, it's not good for them to cross their leg over the midline.
Okay, so stuff like that.
Exactly.
Okay.
So they could do it, if they did it like this, where it's just incremental, like a millimeter or a centimeter, like that could be really good.
Right.
But you wouldn't want to have them do, like a big, like take the leg way over to the side. Yeah. Or do the reclining twist where one leg is long and the other one is bent. They might have better luck if the both knees are bent. Twisting. But we'll get back. Are you getting something out of this? Okay. Anybody interested in a little downward pressure through the lifted leg? Yes. Is that better? Yeah.
Increasing areas of old injuries, that's for sure.
Yeah, because it goes, I mean, this is more, I would even categorize this almost like yin,
Yeah.
where
Yeah.
there's less muscular engagement and we're moving into more of the connective tissue.
And we're gonna talk about counter poses for these.
Yes. So counter, just long story short, counter pose is going to be symmetrical back bending. Right, so we're going to come back to bridge. You like?
It's nice.
Yes. Same, more or less.
A little more.
Okay.
Feels good.
Yeah, little shake is a good thing, a lot of shake, not so much. You want to try going to the crossing over the midline a little bit?
Oh, also Abby, but and everybody else, no pressure on the crossing leg for hip replacement. Yeah.
Have we already done art assisting or nothing?
I don't know that it made it in.
Wow.
So,
It was on
This is
it.
like pretty cool.
yeah, let me look again. I want to say I added it in.
You did, I saw it somewhere.
Maybe it's in the last couple of Wednesdays.
Yeah.
Yeah. something like that. Anybody else want to try the pressure? So this would be some art of assisting. Right, so, again, like standing over someone, not for everybody. Right, and this is, and also they are bound, and so there's some big, big red flags here. Not, this is not trauma informed. Okay, this is like, it could potentially be, yeah, it could potentially be.
Or SEM.
This is like a strong level of familiarity.
I really love doing it with the guy in the small.
This feels good.
Yeah.
Yeah,
It's also.
yeah,
You want to
yeah,
talk
right, like that, yeah. Feels very
So you
supportive.
go to where it goes.
It also like.
Here's like
small
the
massage
same.
all
Yeah.
It's like,
cool.
Because it's gonna increase on that.
oh, yeah. It's just like this thing. This is so nice. I feel like I need to do this every day.
So so Mark Uradell, who was my anatomy teacher, in his home studio, I used to dog sit and house sit for him, to go on vacation. Because we get to stay in the house and use all the equipment. And he built a block into the wall where, like, if he sat with his body, laid with his body against the wall, he could put his leg up and the block would be like exactly the right angle for him to press his foot into in this position.
I was just
And
thinking
that was
about
like,
how I could use this.
that was the only thing that it was for. So you have to
Just
find.
like screw the block against the wall.
Yeah, it was like a wooden slab, like a 2x4.
Oh my gosh.
Anybody else? Anybody good? Good, yeah. We can do that other foot. Yes, I will. I may also be more on your, does that change things if I'm more on your heel? It's cool that it's like the same thing.
What we were just doing. Really?
No, well, at least in my area.
Oh, that's crazy.
Yeah.
You actually have your head.
So, yeah, you feel some stretch for your neck and shoulders, yeah. So Bex just said very relaxing. So, grounding the femurs, like rooting the femurs back into the hip sockets is like the first chakra loves it, and first chakra is home and security, steady, right? So rooting the femurs into their hip sockets.
So how would you do these for people who have trouble laying on their back?
So we would do
Against the wall?
probably more like bulldog.
Yeah.
Mhm. More constriction, like no bulldog, or bringing hands to a chair, leaning back. Okay, when you're done, come to lie on your back again.
So you gotta recruit your beloved to push on your foot. Says I. So counter pose of asymmetrical deep forward bending would be symmetrical back bending. Right? Yes, and I would love for you to use a block between your knees and also have a block handy to put underneath your sacrum. We're gonna do a supported bridge. Yep. So block between your knees and then thinnest or middle setting. And then as you lift up, block, generally gentle, like even if you could come up to the highest setting, you might try one setting lower, but totally up to you. And a moderate squeeze on your block at first, just to reset the two pelvic halves. And then you can lessen the squeeze so that you're just doing enough to hold the block in place. And we're gonna do this, we're gonna do two different bridge poses. This one, and then we're gonna do a more supported bridge pose with a strap here momentarily. Good. Make one more full cycle of breath. And then press into your feet enough to lift your hips away from the block on the floor. Slide that block away and lower down, pause. You can release the block between your knees as well. Good, and then draw your knees in towards your body, roll to one side, and make your way up to sit again, please, for another demonstration. So this is a restorative. Also, since we do now have some trauma-informed training under our belt, and speaking of belts, right? This would not be trauma-informed. Anything where you're providing external binding might not feel good or safe for someone, and especially if their trauma is surrounding that scenario. Hang on, I'm gonna get myself a block. If there is physical injury or dysfunction in the sacrum, lower back, however, this posture and variations of this posture are highly recommended. So for this one, we have a strap around the thighs and you cinch it in enough. You may have done this toward the beginning of the training. So you cinch it in enough that the strap holds the block in place without your legs having to work at all. This is psoas release work. So in this position, you're basically steadying the thigh bones so that the hip flexors and the psoas can turn off completely. So very stabilizing for the two pelvic halves for the sacrum. And I want you to, this is what Judith says too, I want you to cinch the strap in tightly enough so that you can barely slide two fingers between your body and the strap, and make sure that the buckle is in between your thighs and not on the skin. So this is the first option, which is called constructive rest pose. So this is great. You can also add a crossing of the arms over the upper body if you want. That's option A. Option B is to take the same position as before, but now with the strap, and use the lower middle setting with the block And remember, I probably have mentioned this to you before, but remember that when you're using a block underneath the hips and bridge, that you are supporting the sacrum and not the tail. So that it's the same reason why we arch the spine and rotate the pelvis slightly forward before lifting into bridge pose. If I put the block underneath my tail, it actually sends the pelvis into more of a forward bending action. So I want you to support the sacrum and not the tail. So this is an option. Option C, if you do have sacral instability, is to also place a strap around the sacrum. So that one you put on like you're putting on a shirt. And it's gonna go around the thickest part of your bottom. So like if you were, when you go, who gets measured for clothing anymore? But if you ever go and like have your hip size measured, it's where they would put the measuring tape. So it has to be around the thickest part of your butt and hips. And that way the strap is around the greater trochanters and it's creating an external ligament of support for the sacrum. So you can do that in constructive rest and or in bridge. The beautiful thing about the shape of this posture, if the knees are at a 90-degree angle, is that you're still getting psoas release work, even if you don't have all the bells and whistles. So if you don't have the blocks and the straps, you can still get some good stabilizing and psoas release work in constructive rest or bridge. So let me know if I can help you set any of this up or you have any questions. Because we're going to hold here for a few minutes a la restorative yoga. When we first opened the studio, we had a class called Core and Restore. And we would, do more strong step-like planks and core work. And then we would end with a 10 to 15 minute restorative practice. And I always taught this pose. Yeah, Kelly, that might be a little bit high up. The walk. There's like a sweet spot. As well as
It feels more back than me.
neutral.
Neutrally back than me, yeah.
You like it when walk. So again, I would say just a little extra. Try it there. So your tail, you're actually that's so this is where it usually put it. Yeah, so I think that because you want your actual coccyx tail to be in front of. Yeah.
Make sure that this is, feels all right.
Yeah, it's good. And now I had to anything where I thought it was too high, but now I think it's in the right spot. Yeah. Does it feel good?
It feels just.
Well, if I can help, I'm also happy to help with the straps. Because whenever I teach with straps, I usually find my inner stewardess, flight attendant, and instruct how to use the strap with a D ring. They're not intuitive. So once you do, it can really bring you into your rational minds to set up for a long restorative. So give yourself permission to just get focused on the details. And then once you do find the shape, take a few deep breaths in through your nose, out through your mouth. And begin the process of settling in.
Let your breath come back to an easy, effortless rhythm. And remember that the purpose of restorative yoga is to find yourself in a position where you can let your body become heavy and soft. And there's not a lot of specific sensation that's calling to you. So if you're feeling any discomfort, especially in a restorative shape, it might mean that we need to shift something about the shape or choose a different shape altogether. So don't hesitate. If this just isn't jiving for you, you can change to a different position. It might be as simple as lowering the hips back down onto the floor, or placing a blanket underneath the hips on the floor. And call me over if I can help. Good. Take a long breath. Wiggle fingers and toes. And then moving slowly, start to make your way out of this shape. If you're up on a block, you can press into your feet, lift your hips up, slide the block out from under you, and slowly lower down. You can also remove straps. And let's settle in for a longer Shavasana. So for this one, I would recommend, almost like we did for Nidra, we're gonna take about a 20-minute Shavasana. So almost like we did for Nidra, lots of padding. So bolster underneath the knees. Maybe a blanket roll underneath your ankles. If you'd like to build a head nest and you need an extra blanket, let me know, I'll bring you one. You also might like to cover with a blanket or put on an extra shirt or socks. If there are any additional movements that you feel called to do, you're welcome to add those in. Think of the first 2 minutes of your Shavasana as an opportunity to get more comfortable.
Let your breath travel back to an easy effortless rhythm. Give yourself permission to rest. Be. Good. Without changing anything, just maintain awareness on the sensation of body resting on the floor. This body is made of earth and gold, sky and stars, rivers and oceans, masquerading as muscle and bone. Every substance is here, diamonds and silver, magical elixirs, ambrosia that gives visions, herbs that nourish and heal. The foundation of the planet, immortal, magnetic iron circulating in the blood. Every element in you loves the others. Earth loves rain. Sky loves sun. Sun loves the space it shines through. Space loves everyone equally. In meditation, luxuriate in knowing this deep and simple truth. Every cell is an organ of sense infused with majesty. Vijnana Bhairava. Breathe deep. And then breathing easy, start to move again. Keep incorporating gentle and larger movements. Help you make your way back to sit. As you come up to sit, and a long spine, and bring your hands together and Anjali Mudra before the heart, bowing your head to your own heart, to the wisdom of your body, to the practice and teaching of yoga, to each other. Thank you so much. Namaste. Take a break. Let's take a break. Yeah. We're originally going to break from 1 to 1:30. We're 10 minutes of 1 now. Do you want to start at 20 after 1? Is that okay? I will, the Vijnana Bhairava translation here is the Radiant Sutras if you want to take a picture of that passage. For now. We are done with props unless you want to sit. So we're just going to do kind of open-ended exam review. For our break.
What's the strength of those? Is it glass? Sounds very crystalline.
Yes, it's a glass disc.
It's glass.
You're right. I'm gonna,
It's a beautiful
isn't that
sound.
gorgeous? There's 2 of them hanging in the lobby. I'm gonna end this session And I'll open up another Zoom, starting at 1:20.